Hypoglycemia is a short-term complication that means a low blood sugar. An easy way to remember this is hypo rhymes with low. Low blood sugar means that there is too much insulin for the amount of glucose in the blood. Looking at the diagram, you can see there is a significant insulin presence in comparison to glucose in the bloodstream. Let's go over what can cause a hypoglycemic event. Too much insulin. When there is more insulin in the blood than glucose caused by an over-delivery of insulin for the amount of glucose in the blood, hypoglycemia occurs. Delayed meal. When you think of delayed meal, it means a person delivered insulin through an injection or an insulin pump, but they did not eat their meal immediately. So there is too much insulin for the amount of glucose in the blood because you have not eaten yet. Think of the example of eating at a restaurant. You order, give yourself an injection of insulin, but there is a backup in the kitchen that causes your meal delivery to be delayed. This could cause hypoglycemia in a person with diabetes. Low carbohydrate meal. This comes from an inaccurate dose of insulin. If you measure your insulin for more carbs or glucose than what is actually in the meal, it can cause hypoglycemia because there is more insulin in the blood than glucose. High-fat meal. If you think back to lesson 1, fats are more difficult for the body to break down than glucose, so it takes longer for the body to digest a fatty meal than a meal high in carbs. This means that if I inject insulin to begin working in my body right away, but my body is taking longer to break down and digest the food, it could cause hypoglycemic events because there is more insulin in the bloodstream than glucose. Gastroparesis. If you think back to lesson 1, we talked about peristalsis, which is a wave-like motion caused by the nerves that pushes food down through the digestive process. There is a complication of diabetes called gastroparesis, which means that these nerves do not work properly and do not push the food down the digestive process, and food gets stuck and takes longer to push through the digestive system. If someone suffers from gastroparesis, which delays digestion but delivers an injection of insulin to begin working in the body right away, there would be more insulin in the blood than glucose, causing hypoglycemia. Inaccurate carb counting. This comes from an inaccurate dose of insulin. If you measure your insulin for more carbs or glucose than what is actually in the meal, it can cause hypoglycemia because there is more insulin in the blood than glucose. Exercise. When we perform physical activity, the body uses our glucose for energy in the body. Anyone, regardless of whether you have diabetes, does this. If I have diabetes and inject insulin into my body, as well as exercise, the glucose in the blood is used up quickly and can cause hypoglycemia because there is more insulin than glucose in the body. Alcohol. This depends on what type of alcohol that is consumed. Beer, for instance, is high in carbs and does not apply. Alcohol is broken down by the liver. The liver is also responsible for releasing glycogen, stored glucose we discussed in lesson 1. If the body is working in overdrive to break down the alcohol, it is unable to release stored glucose that the body needs for energy, which can cause too much insulin to be in the blood for the amount of glucose and cause hypoglycemia. Stacking insulin. Insulin can last in the body for 8 hours. If I deliver an injection of insulin while I still have insulin working in my body from a couple hours ago, this is called stacking insulin and can cause hypoglycemia. The symptoms of mild hypoglycemia are being sweaty or clammy, trembling, slurred speech, headache, difficulty concentrating, lightheadedness, insatiable hunger, irritability, tingling, and mood change. These can be resolved by eating or drinking carbs. If it becomes severe because someone has either ignored the early symptoms of a low, did not know that they were low, or has become so accustomed to low glucose that it begins to feel normal, severe hypoglycemia can occur. Severe hypoglycemic symptoms are mental confusion, combativeness, and/or unconsciousness. There have been numerous instances where we have witnessed customers being unable to complete sentences or even move because these symptoms became debilitating. They can occur very rapidly and are very scary for people who have diabetes. Oftentimes, glucagon is a necessary treatment. Remember this from lesson 1? Glucagon is the hormone that tells the liver to turn on and release stored glucose. We will talk about this more in a few minutes. These severe symptoms can result in hypoglycemia unawareness, brain or cell damage, coma, and death. There is no specific blood glucose level that is specified as a mild or severe low event. It is defined by the severity of the symptoms that the person suffers from. As a representative who talks to customers on the phone, it is very important that you are sensitive to listening for these symptoms, because we have a responsibility to make sure our customers are safe. There have been instances where our reps have had to call EMS for customers who are showing these symptoms and are unable to care for themselves. The definition of hypoglycemic unawareness is a condition in which a person with diabetes does not experience the usual early warning symptoms of hypoglycemia. Without warning, this can lapse into severe hypoglycemia, which can result in confusion, disorientation, and unconsciousness. Possible causes: nerve damage that affects the body's ability to secrete epinephrine. Very tight control of blood glucose could dull the body's ability to sense the drop in glucose. I think of hypoglycemic unawareness to be like when you start wearing a watch. At first, you are very aware of the watch and think of it all the time while you're wearing it. But after a while, you completely forget that it's there. This is kind of like hypoglycemic unawareness. After a while, if you have the hypoglycemia so frequently, you start not to feel the early symptoms. Then the hypoglycemia becomes severe, and it becomes much more difficult to address it without medical attention and can be very dangerous. In order to treat hypoglycemia, we use the rule of 15s, consuming 15 grams of carbs every 15 minutes and then rechecking blood glucose levels. Check glucose to confirm blood sugar is less than 70 milligrams a deciliter. Eat or drink 15 grams of glucose. Here are a few examples of what you can use. 3 to 4 glucose tabs. 1 dose of glucose gel. In most cases, 1 small tube is 1 dose. A half cup or 4 ounces non-diet soft drink or juice. 1 tablespoon of honey or syrup. 3 to 4 teaspoons of sugar or 4 packets. 1 cup or 8 ounces of non-fat milk. 2 tablespoons of raisins. 5 or 6 Lifesavers or other hard candies. Then recheck blood glucose in 15 minutes. Repeat treatment if you are still at 70 milligrams a deciliter after 15 minutes. In severe cases where a person is unable to eat food or drink by mouth safely, such as when a person has lost consciousness due to hypoglycemia, a person requires a shot of glucagon. Glucagon is a necessary treatment. Remember this from lesson 1? Glucagon is the hormone that tells the liver to turn on and release stored glucose. This helps raise blood glucose by stimulating the liver to release all the glycogen that is stored and causes the blood glucose levels to shoot back up. Anyone can administer it. This is usually prescribed by a healthcare professional, and it may cause nausea and/or vomiting. Now let's look at the opposite of low blood sugar. Hyperglycemia is a short-term complication that means high blood sugar. Hyperglycemia means that there is too much glucose for the amount of insulin in the blood. Looking at the diagram, you can see there is a significant number of glucose in the bloodstream in comparison to the amount of insulin in the bloodstream. Here are some causes for hyperglycemia. Missed insulin dose. If I forget to give myself insulin and have eaten a meal, I would have too much glucose in my blood for the amount of insulin and will cause hyperglycemia. Inadequate insulin dose. If I do not give myself enough insulin for the amount of carbs I am eating, I will have too much glucose in my blood for the amount of insulin and I will cause hyperglycemia. Inaccurate carb counting. If I underestimate the amount of insulin for the amount of carbs I eat, I will have too much glucose in the blood for the amount of insulin and will cause high blood sugar. Degraded insulin. If I use insulin that is expired or has gone bad, it does not work properly in my body and could cause a high glucose level in my blood for the amount of insulin and will cause hyperglycemia. Infusion site issue. An infusion site is the tubing that delivers insulin from the insulin pump to the body. If there is a blockage in the tubing, it can cause insulin delivery to stop. If I am not receiving insulin, it can cause the body to have too much glucose for the amount of insulin working in the body, which can cause hyperglycemia. Missed oral meds. For those type 2s who take orals to lower blood sugars. If they do not remember to take their medication, it can cause too much glucose to work in the body for the amount of insulin active in the body, which can create high blood sugar. Illness and stress go hand in hand. When you're sick or stressed, your body releases coping hormones that cause your blood sugars to rise to compensate. This can also cause hyperglycemia. Here are the signs and symptoms of hyperglycemia. Again, these are important for you to be able to recognize if you're talking to a customer who may exhibit or mention these issues. Increased thirst, known as polydipsia. The body is trying to get rid of the excess glucose that it cannot use. This occurs through filtering through the kidneys and requires water, which causes thirst. Increased urination, known as polyuria. The body is trying to get rid of the excess glucose that it cannot use. This occurs through filtering through the kidneys and requires water, which causes a need to urinate because all the liquids the person is consuming. Increased hunger, known as polyphagia. The body understands that it needs energy, so it makes a person hungry. The body does not recognize that the lack of energy is coming from the lack of insulin in the body to convert the glucose into energy. We call these the 3 polys. Other symptoms are blurred vision, being tired, sleepy, or lethargic, headache, slow healing of wounds, more frequent infections, and weight loss. More dangerous high blood sugars are symptomatic of a short-term complication called DKA. These symptoms are fruity breath, because the higher sugar levels in the body make the breath sweet. It is said to smell like bananas. Abdominal pain, nausea, vomiting, Kussmaul's respirations, which are deep, rapid breathing characteristics of diabetic acidosis. This is the lungs' attempt to blow off excess acids in the form of CO2. And ketones in the urine. DKA, or diabetic ketoacidosis. This is characterized by insulin deficiencies and is almost exclusively seen in type 1 diabetes. Without insulin, your body cannot use the available glucose. This causes your blood to become saturated with glucose, causing hyperglycemia. The body, desperate for energy, begins to break down fat. Ketones are an acidic byproduct of the fat breakdown, which causes the blood to, in turn, become acidic. This is called metabolic acidosis. Due to the high levels of unusable glucose and rising levels of ketones, the kidneys tried their best to remove them from the blood. However, the kidneys are soon working beyond their ability and begin to pull in large amounts of water from the body. This causes osmotic diuresis. This increases the amount of water loss, which usually ends up with dehydration. The dehydration causes an electrolyte imbalance, which can cause a decrease in blood pressure. The end result may be a coma and sometimes even death. Diabetic ketoacidosis is on the opposite spectrum of severe low blood sugars. Another short-term complication is called dawn phenomenon. This is an early morning rise in blood glucose levels. Hormones produced by the body cause the liver to release large amounts of sugar into the bloodstream. These hormones are released in the early morning hours. It is the body's way of waking us up and getting ready to start the day. If you do not have diabetes, your body is easily able to bring those blood sugars back into range. But if you do have diabetes, it isn't as easy. 89% of the patients with type 1 diabetes experience dawn phenomenon. They require more basal, meaning background insulin, in the early morning hours for optimum control. There is no easy way to compensate for dawn phenomenon with injections, but an insulin pump is able to adjust for these rises.